Oh, hi. You're quite early today for your appointment. How are you? Okay, I'm glad to hear that. Do you mind if you can just wait over me at the reception? I will be with you shortly. Would you like anything to drink while you wait? Some water, coffee, juice? Okay, I'll be with you shortly. Welcome back again. If you can just take a seat over there. It's nice to see you. How have you been? You've been good? Well, I can tell. Have you been following the doctor's orders as prescribed? Have you been taking your medication properly? Okay. Well, I think we just need to get started. Let me just go ahead and get your file. Open up your file and let's see what we need to do today. Okay. Right, so can I have your name again, please? Okay. Alright, and okay, here we go. Think we're gonna get started. So what we're gonna do today is we're gonna do just a general medical checkup. I'm gonna go ahead and check your eyes, check your weight. We're gonna do some breathing exercises. We're gonna go and do some cranial nerve, reflexes and so forth. Okay, are you ready? All right. Okay. So I'm gonna go ahead and check your file. Okay. All right. So what I would like you to do for me is get on the scale. So I just want to take your weight just to see whether you've gained or lost any weight since the last time you were here. So if you can just get on the scale for me, please. Let me just see. Okay. I can see that you haven't really lost or gained any weight, which is quite well. I'm gonna just write that down and I'm going to just record that. Well done. Okay, so I'm just gonna go ahead and take my gloves. So have you been eating healthy? Have you been taking your fruits and your vegetables? So what I'd like for you to do for me is to just lift up your top slightly, please. If you can just lift up your top. Yeah, so what I'm going to do is I am going to just tap you on your back and I'm going to ask you to please cough for me 3 times, okay? Okay, so I'm just going to tap you on the back. Please cough for me. Okay. Cough for me again. And cough from me once more, please. Well done. Okay, let me just record that. Alright. So what I want to do is that I want to trick your breathing technique. So we're going to do some breathing exercises, okay? So I'm just going to ask you to breathe in for me, hold your breath for about 5 seconds and breathe out through your nose, okay? Alright, so if you can just breathe in. 1, 2, 3, 4, and 5. Now just breathe out for me. Well done. Okay, I'm going to ask you to please do that once again. Just breathe in. Take a very deep breath for me. Breathe in. 1, 2, 3, 4, 5. Are you okay? Okay, it seems like you struggle to hold your breath for quite a bit of time. It's quite worrying. I'm going to record that. Okay. So now we're going to move on. Have you been having some sort of symptoms lately since the last time you were here? Maybe have you been reacting to the medication that was prescribed to you? Or you've been having pain on your neck and your shoulders? Okay, that's interesting. I'm going to go ahead and look into that. So you're saying that you're having a bit of pain right here on the neck and on your shoulders. Okay, so I'm going to just ask you to sit still, and what I'm going to do is that I'm going to move you around, right? Just going to move you all the way to the left, just slightly. Do you feel anything when I move you? Painful? Okay. If I move you all the way to the right, do you feel anything? Okay, then I'm just going to go and move you all the way up and down. How does it feel? Quite painful. Okay, that's very interesting. Okay, I'm just gonna go ahead and take a real closer look. What's going on here? Okay, I can see that you have quite a bit of inflammation around your neck. Your neck seems a bit swollen and your shoulders are a bit stiff. Have you been working out like I asked you to? Alright, so what I'm gonna do is that I'm gonna try and readjust your neck and realign it. Okay, so I'm gonna crack your neck and your shoulders. Okay, it's not gonna be painful. So what I want you to do is to sit still. So what I'm gonna do is that I'm gonna first just massage your neck. I'm gonna massage your neck. So now what I'm going to do is I am going to just crack your neck, okay? I'm going to just slightly just crack. Okay, and I want you to sit still, okay? And I'm going to just turn you around like this. Okay. I want you to sit still. It's not going to be painful. And I'm just going to go ahead and just come close and just... There we go. Gonna go ahead and crack again. There we go. Well done. And now I'm gonna move you again over this side. Like so. Now I'm gonna come all the way this side and just crack your neck. How does it feel? Okay, just relax. I need you to breathe in and out. Okay, just breathe, 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 and then there we go. I'm gonna ask you to breathe. There we go. Well done, well done. How's your neck feeling? Do you feel better? Okay, what I'm gonna do is just I'm gonna check. I'm gonna just move you again over this side, move you again over that side. Okay, how does it feel? Do you feel much better? Okay, beautiful. Let's record that. Okay, so what I want to do is now I want to go ahead and check your eyesight, okay? So I'm going to go ahead and check if everything is okay. I'm going to just open your eye, right? Okay, and this one. Okay. And I want you to please tell me what color is this pen over here? It's green. Okay, well done. Can you please look over here for me? Okay, look over here for me. Look over here for me. And look down here for me, please. One more time. Let's try that again. I want you to look over here for me. Look over here for me. Look over this side and that side. Okay, hold on. Okay. Alright, so now I'm going to ask you which one is better, okay? I'm going to be using a lens and I'm going to ask you which one is better, with the lens or without the lens, okay? I want you to pay close attention to this. Which one is better, with the lens or without the lens? 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 Which one is better for you? Without the lens? Okay. Okay, so now I want you to please tell me what is the color that you see right here. Okay, so what is this color? What color are you seeing? Purple. Okay, that's quite good. Okay. So what I want to do is I'm going to go ahead and just cover your eyes with my hand. And I'm just going to press gently. And I want you to try and open your eyes. Open and close your eyes while I press. Okay. Do that again. Once more. Do that for the last time, please. Okay. Now I want you to look all the way here for me. Okay, just look over here. Can you tell me how many fingers am I holding here? 2. How many fingers now? How many fingers am I holding now? How many are you seeing now? Okay. Well done. Okay, so now we are going to go ahead and do some cranial nerve reflexes. Okay, so what I'm going to do is that I'm going to ask you to move your brows up and down. Just move your brows slightly up and down. Okay, nice. Well done. Okay, so now I am going to ask you to just smile for me. Smile for me. Well done. Well done. Smile for me again. Well done. Well done. Well done. And now I'm going to ask you to give me your best frown. Give me your best one. Well done. Well done. You're even cute when you frown. Okay. Let's record that. Alright, so now I want you to just put your shoulders up and down like so. And I want you to do this for 5 times, okay? Just put them up and down, and I'm going to count you down, okay? Start. 1, 2, 3, 4, 5. Okay, now I want you to do the same thing. I want you to lift that, but now I want you to resist me pressing them down, okay? I want you to resist, 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 and resist. Well done. Good job. You've done really, really well, and it seems like you're getting better and you're kind of following the doctor's orders. So what I want you to do is I'm going to reduce your prescription, okay? Because it seems like you're getting quite better. Okay, so what I want you to do for me is that I want you to try and eat as healthy as possible, okay? If you can do, I just want you to just completely stop eating fast food. You know, I want you to start eating more cooked meals regularly, okay? No more takeouts, okay? No more fatty foods and no more acidy drinks like sodas and all of those things, okay? And now I want you to please try and drink water as much as possible. 8 glasses per day to be precise, okay? Okay. And also, you know, I noticed that you don't really work out a lot. So I want you to start, you know, waking up. Even if you can do like a 30 minutes workout, that will be perfectly fine. You can just jog or just have a nice walk. 30 minutes per day, that would be just enough, okay? So just exercise regularly. Okay, and then last but not least, you need to just stay away from, you know, your phone screen or your television or desktop screen. You know, don't spend too many hours on the screen, you know, just in case you strain your eyes, okay? But your eyes are quite functioning well, you know, but for your age, you need to start, you know, learning how to stay away from looking at the screen for too long, okay? Yeah, so don't strain your eyes too much. But so far so good. Your weight is good. I'm a little bit worried with your breathing, but you know, everything seems to check out, and I'm really happy of the progress that you're making. So next time, your next appointment, we're going to be doing some blood tests and so forth. So I can't wait to see you, but for now everything looks good. So I'm just gonna go ahead and just give you all of this information. I'm going to email it to you so that you can see your progress, but everything is looking good. Thank you so much for coming by. So I can't wait to see you again on your next appointment. Alright, so have a good day. Bye.